Ngākri Nangi, everyone. Nana Michi Paul Worley, Ngāpi Puteri Māori Pamarakon, ka Nanajeri Rui, Aninek Nanajeri Rui. G'day, my name is Paul Worley. I'm the Executive Director of Clinical Innovation here at the Riverland Academy of Clinical Excellence. These grand rounds are an opportunity for our staff and friends and colleagues and collaborators to hear from thought leaders from around the world and to be inspired and to see how we might be able to collaborate with producing an evidence base that is relevant to our region and improve the practice so that the patients in our region get the high quality care that they always deserve. Today, we've got the opportunity to think about how that evidence gets into practice. And the technical term for that is research translation. And we're very fortunate to have an internationally recognised group here in South Australia that brings together all the South Australian universities, all the South Australian health services, both primary health networks and the local health networks, and the Aboriginal health sector. So a wonderful opportunity to hear from a collective that is right at that sort of cutting edge of, okay, we create all this great research, but how does it get into practice? And the person who's really well placed to do that is the person who herds all the cats of those organisations and has done so really well, the Executive Director, Dr. Wendy Keech. So Wendy, pleasure to welcome you here to the Academy and look forward to hearing what you have to say.
Thanks, Paul, and thanks so much for the connections and things that we've built over the last few years. I think it's amazing, and I think we're well positioned to really do some great things in the future. Firstly, I'd also like to pay my respects to Elders past, present and emerging, and recognise that I'm on Kaurna land here in Adelaide, and just acknowledge the important work that we all do to reduce the gap as much as possible. So acknowledging land is vital for us all. So I'd like to start by really introducing to you what health translation centres are, and then having a bit of a look at what we do in South Australia. Some of you will be familiar, I hope, with what we're doing, and this will really just confirm and consolidate the knowledge you already have. But for some of you, you might start to think, oh, this is interesting, how can I get involved? And at the end, I will give you some opportunities on how to do that. We are a statewide translation centre, so to that end, we are looking to see what we can do across the entire state. We are based primarily in Adelaide, and so that is an effort for us to make sure we have an eye on the whole state. And it's great to be working with people like yourselves and with Paul to keep us true to that plan that we are working to. So what I want to do now is really introduce translation centres, the strategic process that we've been going through, and I guess, as I said, provide opportunities to get involved in 2025. So who are we? We're an NHMRC accredited research translation centre. We're South Australia's statewide one, and as Paul said, we have 11 partners, and I'm going to introduce those to you in a moment. Now, importantly, we are accredited by the NHMRC, and most of you will be very familiar with the NHMRC as the big funding body that makes a big impact on Australia by giving out the funds and also putting a lot of the guidelines and policies in place around how research is done and what research and what the priorities that should be addressed. And to that end, I'd like to recognise that the regional capacity building in regional Australia is absolutely a priority of the NHMRC and the Medical Research Future Fund. But let me keep on track, and I'm talking about the NHMRC at the moment. So the objectives of the research translation centres are to improve the health and wellbeing of patients and communities through the translation of research into healthcare by promoting leadership in health service research and its translation, addressing the most pressing priorities of health services and the populations they serve. Now that's really important because that actually addresses the stuff that you're doing. What matters the most to you guys? The next point is strengthening collaborations between health services and research institutions. And this is really part of why these translation centres were established back in 2015, which is to bring the research world and the health service world together. Because up until this time, even though there were champion activities happening, for a lot of things right across Australia, health services were sitting over here and research academic institutions were sitting over here, and they weren't as connected as they are in some other parts of the world. So it was a really strategic move by the NHMRC to say, let's bring these things together, closer together, through the creating research translation centres. The next dot point is about providing comprehensive training and education, which is something that we do a lot of, and also by building robust research and translation capacity and capability. So those 4 points are really the things that drive us as a research translation centre. There are actually 12 accredited research translation centres across Australia, and to become accredited, you have to prove that you and your collaboration are doing those 4 dot points, and that is really the vital stage that you're all at. Now, as I said, there's 12 accredited translation centres across Australia. Some are statewide like us, and some are regionally based. So, for example, Monash University has one that is a regional but sits around Monash. Similarly, University of Melbourne, University of Sydney and University of New South Wales have one that are just a regional location within a metropolitan area. But we all come together as the Australian Health Research Alliance. It's called ARA, and the translation centres really try to work together through the ARA Council to ensure that we're doing the best for Australia as a collective that we can. There are 2 other translation centres that have emerging status, and they are yet to jump over the bar, which is an internationally set standard where they really review our applications to make sure we're doing the things that they want us to be doing. So our purpose for Health Translation SA is to improve the health outcomes in South Australia through research translation. Our purpose is to that was our vision. Our purpose is to enable the timely and effective adoption of research outcomes across the South Australian health system. And the health system is important. It's not just about SA Health, it's about the health system. So it includes primary care and all the other bits in between. And our way of working, and anyone who's familiar with the way we work, we really are an independent catalyst and broker trying to mobilise collaborations around things that matter. So it's between our partners, but also other stakeholders. Our partners, as you'll see on the slide, are SA Health and all the local health networks. So all the local health networks fit into that little icon, and that's a challenge to reach all of them, but we work hard to do it the best we can. We're based at SAHMRI on level 8, and we are administered by SAHMRI, but we're not SAHMRI. We're actually an independent group, and we're a collective of all these logos that you can see. But we really appreciate the support SAHMRI gives us. We also have the Flinders University, Adelaide University and UniSA as key partners. And as you can imagine, with the merger of Adelaide University and University SA, we're having some conversations there about what that looks like. We've got the Aboriginal Health Council as an important partner, along with the 2 primary health networks. And then the Commission of Excellence and Innovation on Health have joined as an independent partner. They are obviously connected to SA Health very strongly, but they wanted to be involved independently. And then we've got Torrens University and CSIRO. Now, they're both interesting partners because they are national organisations, so they bring a particularly interesting perspective to our work and the work of our little motto there, our 3 words: research, action and impact. So why focus on research translation? Why were these research translation centres actually created? And it's really recognised that billions of dollars, and I think it's $1.5 billion, is actually spent on health research each year. And we know that getting scientific discovery into everyday clinical practice still takes a long time. And really, not a lot of the research is actually implemented into practice. Now, we appreciate with research, some things aren't going to be successful in research and they're not going to be translatable. But even those findings of things that don't work need to be put into the mix so that people can learn from them. But what we want to be able to do is the things that are successful, we want to get them into practice, because 60% of healthcare is in line with the evidence. 30% of healthcare is actually recognised as wasteful or low value, and 10% of healthcare potentially is actually causing harm. And that's a well-cited stack of numbers, which we actually think about quite a lot, because what we want to be doing is getting the best evidence in to make the biggest difference. We want to connect health services, researchers and community, and we work a lot to make sure the community's voice is actually heard by the research world, and also the health service clinicians and other policymakers and people that are within health services, that their voices are heard by researchers, so that the things that matter the most to them are the things that are being researched. Because often researchers have great ideas and go racing down the road with their idea without really thinking, is this actually what matters to the health system? So we are trying to do that piece of work of bringing it together. We want to reduce research waste so that more things have impact, and to really ensure that research achieves real world impact. So Health Translation SA, since we were established, and this is really since 2018, we've actually done a bunch of stuff, and we've grown from really no staff to a robust team that are delivering things, but we're only a small team, but nevertheless a robust team that's delivering things across the state. We've catalysed funding up to about $78 million have come in through, and we've touched it in some way, shape or form. We've connected well over 1,500 people in through our collaborative networks. We've supported over 120 projects to be successful across the system, trained over 8,000 people in various courses, and we've linked over 160 research teams with consumers. As some of you will know, we do have a research register, which its job is to really connect with researchers, and we provide advice on how to do that. So we're really proud of the work we've done over the last few years and the profile we now have across South Australia. So in 2024, no, sorry, that's this year. Oh yeah, maybe it was earlier this year. So April, it's been a long year. In April 2024, we convened a big workshop at the Convention Centre, and we really looked at what we had been doing across the last 3 years, so from 21 to 24, and we identified the things that had worked and worked well, and we also identified the gaps and the things that we probably could sharpen. What was recognised at that stage is that HTSA could probably be more focused, and that we were trying to do too many things, and we're only a small team, as I said. So to actually focus our effort on a few things was the insights we got from that workshop. And there was about 50 leaders from across South Australia who attended, from health services and the academic institutions. And so we agreed on our vision and our purpose, which I've already mentioned to you. We agreed on our way of working as an independent catalyst and broker. But what we did, which was a little different, we identified the 3 strategic priorities on the right of this slide as our main targets for the next 3 years. The first one was to address key health issues and strengthen collaborations to address these health issues that are affecting the state, and make sure that these issues are statewide. So that's something I'll go into a little bit more detail in a moment. The next one was to really optimise the system, meaning that there are some things that don't work very well in South Australia, and we were seen as a good organisation to be able to mobilise those. It doesn't mean we have to do everything. What it means is we can actually advocate and be bringing together groups, that way I've already said that we're mobilising groups, bring people together to talk about the problems that matter to everyone and that are getting in the way of research translation, and try to look at what those solutions are, and then advocate or support or do whatever we need to do to try and push those solutions forward. And the third strategic priority, and this is the one that probably we had been doing a lot of anyway, so it's really an opportunity just to build on what we've already done, is to empower the people, build the capacity and capability of individuals involved in research translation so that they really are impactful. Now, you'll see that all three of those priorities align really nicely with what the NH and MRC want us to be doing. And so we've got a great alignment now of the NH and MRC saying, you need to do these things, and our partners and their representatives saying, these are the things we want you to do. And that's the position we're in for now, right now. So I'm just going to give you, before I go into the content, I'm just going to let you know the guiding principles that are driving these next 3 years. And this was important because this changed a little bit about what we decided to do, what we're doing. So firstly, it was to leverage the strength of our partners to achieve the collective purpose. So it's not about HTSA as an individual organisation. It's actually about us bringing the strength of our partners together to achieve things. So that actually means our little team of only 6 people are actually really big because we reach a whole lot of people. So it's that ability to leverage strengths that's important. We add value rather than substitute the work of our partners. We found that there are a few activities we were doing that the university should be doing and we shouldn't be trying to do them, and it was getting them a get out of jail card almost. Similarly with health services, there are things they should be doing in their research programs that we shouldn't be doing. So we were able to very much define our position. We also recognised that we need to work on improving the system, which I've already mentioned, and focus on statewide priorities. So it's really nice to have these principles now because these guide everything that we do. So moving on to the projects that fit under these strategic priorities, what we've been doing in the last couple of months is a desktop review of all the plans that are out there, all the strategic plans, the research plans, all the things that are either LHN level, commission, PHNs, everything, to say what are the priorities that you've got. And we've been looking at the work that Riverland Murray Coorong have done and RACE to see, we can only access what's on the desktop, what's published on websites and things, but we've been doing that work. And we're just about to present to the HTSA board tomorrow. And incidentally, our board is a representative from each of our partner organisations, and we're plus consumers. We are presenting to them about what are the potential priorities we're going to work on over the next 3 years. And that'll be about building, priority setting, recognising the strengths, building collaborations, and then looking at new grants. But we've got some principles around equity and also around making sure that's statewide. We also work with the Research Office Network, which is across all the universities and the health services. This is something that's really important that because they weren't really talking to each other, so we've been able to bring them together. And if you do have a research office type person within RACE, we could bring them into that group, or you might already be in it. I can't remember. We do a lot of research translation project support, and we have the Catalyst grant scheme. And I know that you were successful in that previous grant round, so hopefully that was helpful funding that you've been able to put to good use. I'm sure it has, and we had that report at our recent presentation day. Our next thing around optimising the system, we're working a lot on trying to get research actually embedded in the health system. And obviously you guys are leading the way in terms of a regional LHN, but we found certainly a few years ago, the worlds were really quite separate and research was not prioritised in health services. It feels like it's moving a bit, but compared to some of the other states and other countries, we've still got a long way to go. So we really need to build a research-rich health service that really doesn't have to segregate research and health. It's actually all one of the same thing because it's about the value to the patient. We're doing a lot of work on data access for research. And what I find is that every time I'm in a data access conversation, it's about data access for health services to inform their practice, which obviously is critically important. But there's a huge opportunity we're missing because we're not making the data accessible to research for people who are outside of the system. And so working out a mechanism to do that is a high priority for us, but we've set up a number of groups now that are working towards this. And we also have doing a lot of work in the implementation science area, working with Rachel Nurek, who's in the department. We've set up a leadership group across the state, which has representatives from all the academic and institutions that are working together to say, if we are implementing research findings across the health system, how do we do that using the best possible science? How do we evaluate it? How do we use the models we know, help people think through that? And then how do we work out what works, which bit works and which bits don't work? So that is a science in itself, and we're really prioritising that in the next 3 years. Some of you I know attended the Research Translation Essentials course, and that was great. And we continue to do the Spotlight series, and we're actually thinking of doing one next year on regional research. We also are making sure our networks are working on our priority areas. And as I've already mentioned, we do a lot of work in consumer and community involvement in research. We have a register that gets used widely. We have an action group, and I don't think there's anyone from RACE or from Riverland Murray Coorong on the CCI action group. That could well be a good thing to do. And just mentioning that we offer a lot of training and support in that area, and it's something that is very well used by people across the state. And finally, I just thought I'd mention a few things of ways that you guys might like to get involved. We have many connected opportunities in 2025. The Implementation Science Network has 3 face-to-faces, and we're going to do 1 virtual next year where people can listen and learn. And we usually have groups that are wanting to implement the project, present or need some guidance, and then the experts are able to sit around and in a really safe environment critique it and have a chat about things. I mentioned the action group, the Consumer and Community Involvement Research Action Group, and that meets, I think it meets 5 times a year, but it's a really great group, and they are talking about really practical ways to do this. We run a masterclass in that area now, which got sold out a couple of weeks ago, which we were very pleased about, and we're looking forward to running that again in 2025. We're working with the Commission of Excellence, Innovation and Health to do a patient-reported measures collaborative symposium, and that's going to be in March the 25th, and that's really about the patient-reported measures work that's going on across South Australia. How can we bring a research lens into that? Instead of it being a standalone system change for health services, how do you actually incorporate research into it so that everyone makes the most of a fabulous asset that's being built? I've mentioned the Research Translation Essentials course. We're running another one in April and also September. We have our health service priorities projects that I mentioned, and we're coming up with those priorities. We'll be running summits over the course of the year on each of the priority areas, and we look forward to bringing those together. And I won't preempt what they're going to be, but they'll be things that you go, yeah, no doubt that is a priority. We've got the Catalyst Grant Scheme coming again, and we've got all 3 of the funding partners from this year. So that's Cancer Council, Women's and Children's Hospital Foundation, and the Hospital Research Foundation all agreeing to fund it again, which is great. And there's a range of specific projects, and Paul's just got involved in the acute care grant, or actually in the management of the acute care grant for us. So there's a lot of things going on across the world that we are in. We really enjoy the work we do, and look forward to doing whatever we can to bridge into the world that you're in. So hopefully that's helpful. Have I stopped sharing there, Paul?
And an into you, Wendy. Yes, you have. Thank you so much. Just in that very brief presentation, a few things that are so relevant to us. Firstly, feedback, the Catalyst grant that we won, and thank you for that, has resulted in an MRFF grant application, and we're just waiting on the results of that. That should be early next year that we hear that. It came across as very clear to me that you only know what we're doing by being able to interrogate our website and our web presence. So our communication strategy is absolutely critical for collaboration with external people.
I guess I know more because I attend the advisory group, But when I ask my staff members to say, okay, can you please get a snapshot on what's happening across the state, the only easy way to do it is, in the first instance anyway, is through the websites. Our next stage of the priority project is to actually circulate a survey to each of the LHN CEOs and other key leaders across the system, for them to firstly validate the priorities we've identified, and secondly prioritise the priorities. So it's not the only way we collect information, but it has been the first way that we've been able to make some sense of it all.
Yeah, no, that's good. That's a good reminder for us. And the two areas that I picked up that we certainly could be involved in are the CCI Action Group and the RGO network.
Great.
Both of which would be, very relevant to us, and very important that there's a rural voice there. One of the areas I just wondered whether you could give us some advice or some clues on. Your figures right at the beginning were quite confronting. It's only 60% of care evidence-based medicine, 30% waste or low value, 10% harm. How can we measure that for us? As a regional LHN, how can we go about measuring? Are we at the 60% mark, or are we actually at 80? Are we actually at 30? And we've got a whole lot of low value care. How do you know how you go about that research? Or can you point us in a direction?
Well, firstly, I'll share the paper with you.
Yeah,
so that we can actually get that context, and I think that's probably a starting point. But it's probably a broader conversation to actually think about how we do that at a state level, how we measure that. I mean, there's a methodology that was used to actually come up with those statistics. So I'm sure we could think about what that methodology is and was, and see how we can apply it to the worlds that we live in. But probably it's a big conversation to have, but something that we should put on the agenda.
Yeah, that potentially might even be something that we, as a relatively small network, may find easier to pilot and work out some of the kinks in the methodology that could then be something that our state actually has as a guiding resource, and if you like, a bit of an accountability instrument too. Are we improving?
That's a great idea, and I think it is something that we could do. And there's a lot of things that we can do in South Australia that others can't, and then we can actually do it because we have these connections. And I do think it's something that it's pretty scary to think that the sort of statistics that are out there. But when you hear stories from consumers, you realise, okay, it's probably pretty accurate.
Yeah. So thank you for spending the time to condense years of work into a 20-minute presentation, and recognising that it's not just your work, but there's a team of 6, which then links to a team of hundreds across the state. And we're really glad to be part of that, and we're very thankful that you're on our Race Partnerships Council as well, and able to provide advice at that level. I hope that people have seen opportunities for how they may be able to get further involved or more effective at research translation, because that is what the Academy is about, taking responsibility for our own workforce creation, providing an evidence base for care that's relevant to our region, and then combining both of those into quality improvement in the care that we provide for the patients we serve. So thank you for all of that, Wendy, and thank you everyone for your attendance today. Our next grand round is next week, when we'll be hearing from Maria Inacio, from Rosa, and I believe Rosa are also co-located near you.
Yeah, they are. They are, and they've also been one of our flagship programs. We were very involved in the early days of Rosa, and also very involved in when they were really influencing the Royal Commission on Ageing, when we were trying to figure out how to get to make sure that all the great things that they knew were actually taken seriously. And there was a lot of strategic work done with the Commonwealth to think about how we impact and how we get those research findings into it. And you'll hear the story next week about how they did and how they continue to do.
So health translation this week, aged care next week. Fantastic. Thank you very much, everybody. Anu Ninti and Nakan. We will see you later.